All right, we're back with Dr. Limongelli from the Yonkers. Dr. Limongelli, lots of us people have missing teeth. Well, not necessarily in the front, but in the back. 1, 2, 3, and sometimes they're missing for quite a while already. And nothing really bad is happening, at least so we think. And I know I had a whole bunch of these missing for quite a while, and nothing bad was happening. And yet every dentist keeps telling us that we really got to take care of that, that there are lots of bad negative effects. Can you shed some light on it? Why nothing happens right away, and why does it look like it's all okay, and yet apparently it's so important?
Eventually something will happen. There's a lot of people that are fortunate. The space can stay exactly the same way for many years. In other patients, it moves a little quicker. Usually what happens is that the adjacent teeth tend to drift inward to the space in attempts for the body to close it. The opposing tooth, whether the tooth is missing on the top, the tooth on the bottom will grow upward, or if the tooth is missing on the bottom, the tooth on the top will grow downward, also in attempts to fill the space. In so doing, these teeth go out of alignment. The top tooth, if it's the one that's growing downward, grows out of its original position. If it's the bottom tooth, it's the same scenario. The bottom tooth will grow upward. As the teeth drift into the space, the teeth in front of them and behind them tend to space. In other words, if a top tooth is lost toward the corner of the mouth, the front teeth all tend to drift backwards, creating spaces between the front teeth. In order to prevent this, it's advised that the missing tooth be replaced as soon as possible. And there are various modalities of replacing missing teeth. The most popular one currently, and most likely agreed by all dentists, is an implant. The advantage of having an implant done is that it doesn't involve the adjacent teeth, as it does with having a bridge made. If you have a permanent bridge made, the tooth on either side of the space is ground down in order to have a cap made. Of course, when the cap is made, the teeth are restored to their original size, shape, and color. But a better way of doing it to prevent those teeth from being ground down is with an implant, which is simply a screw-like device that goes into the bone. It preserves the bone, and usually within a 6-month period, a crown can be made to go over the implant, which replaces the missing tooth and doesn't involve the adjacent teeth.
Okay. Let me stop you there for a little bit, because we're talking basically about missing, the missing teeth. So basically, the missing teeth do completely get out of alignment, a little bit like a fence. Like, if you have a few fence posts missing, and they start going and go blah 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 blah. They start playing a piano, and all havoc breaks loose, and then all of a sudden you start looking ugly in the front as well, simply because the teeth all over the place keep shifting, as you said. That's correct, right?
That's a very good analogy. That's exactly what happens.
Yeah, and what you're saying is that it doesn't necessarily go very fast. Sometimes it goes faster, sometimes it goes slower. And what I hear is that once it does, and I can, taking the fence analogy, having worked like not necessarily on a farm, but having worked with fences and things, they look okay. But once it does get loose and crooked, that thing falls apart very fast. You know what I mean?
That's correct. Once it starts, it progresses a lot more rapidly, and it becomes more difficult to correct, especially the spacing. The spacing may not be able to be corrected.
Right. So I can see that. Now, also, there are some people who claim, some dentists who claim, and some patients who have apparently witnessed it and noticed it, that as their teeth get out of alignment, is it true that because of it one could get tense muscles and even headaches and stuff like that?
Yes, as the teeth go out of alignment, it puts more of a strain on the joints of the lower jaw, called the temporomandibular joints, the TMJ. And a lot of people with malocclusion or uneven teeth complain of pain in the joints, which sometimes can radiate to the temporal area of the head and down the neck and to the back of the neck as well.
Wow. So basically, your missing tooth not only can make you look ugly, can make you losing other teeth, but also can give you headaches and tension in your neck and stuff like that, and that probably isn't comfortable.
That's true. It's called myofascial pain dysfunction, and that's exactly what it is.
Wow. Okay. So obviously, the conclusion is we should fix our teeth. We should get the missing teeth in there. It's almost like, God has given us whatever, how many teeth. How many teeth is it anyway? I forgot. I don't know.
32.
32. Has given us 32 of them, and we should keep them in. Naturally would be the best, and if not, as you started to mentioning, there are obviously ways to, to replace them so that that the function of the teeth is still there. All right? Good. I'm going to check with you back on some of the ways on how to fix that more specifically. But I think we got the idea that missing teeth should be replaced, because who wants to have an ugly front face? Who wants to have headaches and that type of stuff? And maybe there's some people out there who have headaches and all kinds of tension, neck pain, and they don't even know that it comes from the teeth. Is that possible?
That's true. That's true.
So,
and they make their rounds to different specialists, ENT doctors, to dentists, to oral surgeons, until they finally find out that it's a joint problem stemming from a malocclusion.
Yeah, so they go and take a truckload of aspirin before they find out. All they needed to do is maybe straighten out their teeth.
That's exactly right. Mm-hmm.
Well, all right. Thanks a lot, Dr. Limongelli.
A pleasure.